Please like and subscribe.
Introduction. Angioplasty, also called coronary angioplasty or percutaneous coronary intervention, PCI, is a minimally invasive procedure in which a thin, flexible tube called a catheter is used to place a stent inside the blocked coronary arteries in your heart to clear the blockage from plaque deposition and improve blood flow. The coronary arteries are the blood vessels that supply oxygenated blood to your heart muscle. They can start narrowing as we age due to plaque deposits on the inner walls, a medical condition called atherosclerosis. Indications. Angioplasty or percutaneous coronary intervention is recommended for opening up and expanding the narrowed or blocked coronary arteries in your heart. Suitable candidates are people with heart diseases such as coronary artery disease or CAD, atherosclerosis, chest pain or angina. Before the procedure. Depending on where the catheter will be inserted, you may be asked to shave the area a day before the procedure. You are asked to change into a surgical drape or hospital gown. Shortly before your procedure, you may be administered sedatives to relieve your anxiety and keep you relaxed. An intravenous IV line may be inserted in order to facilitate quick delivery of medications. Electrodes are placed on your body to monitor your heart. A small device called a pulse oximeter may be clipped on a finger or ear to track the oxygen levels in your blood. Angioplasty procedure. The general steps for angioplasty or percutaneous coronary intervention include: you will lie on your back on the procedure table. The insertion area, either the groin or the arm, is sterilized with an antiseptic solution. Then a local anesthetic is injected into the skin where the catheter is to be inserted. This numbs your skin and keeps you comfortable and pain-free during the procedure. Your doctor will make a tiny cut at the insertion site. Through this incision, the catheter is inserted into your blood vessel. Under a special type of X-ray called fluoroscopic imaging, the catheter is threaded through the blood vessels into the blocked coronary arteries in your heart. After positioning the catheter, a contrast dye is injected into it. When the dye reaches your bloodstream, you may experience a brief flushing sensation or warmth. This is harmless and lasts only a few minutes. The live X-ray displays the flow of dye through your arteries and helps identify the blockages in the blood flow. Then, a thin guide wire is passed through the catheter until it reaches the blocked or narrowed artery. Next, an expandable balloon with a stent is passed towards the end of this guide wire to the blockage. The stent is a small metal mesh tube that is used to open up the blockage in the artery and prevent it from collapsing. Once the balloon reaches the blockage, it is inflated and deflated multiple times to secure the stent in place. This compresses the plaque against the artery walls and helps to open up the narrowed arteries and restore normal blood flow. After the blood flow is restored, the balloon, catheter, and guide wire are removed while the stent is left in place. The incision is then closed and covered with a bandage. Post-operative care. You are allowed to go home the same day. However, some people may require an overnight stay for observation. You may have slight pain or discomfort at the insertion site, for which medications will be prescribed. You may resume your normal daily activities, but should avoid strenuous activities or sports for a week after angioplasty. Risks and complications. Although percutaneous coronary intervention is a relatively safe procedure, it may have certain risks and complications, such as bleeding from the catheter insertion site, blood vessel damage from the catheter, irregular heartbeat, blood clots, kidney damage from the dye used during imaging, restenosis, reaccumulation of plaque or scar tissue causing narrowing or blockage of the coronary artery, occurs within 6 months, dislocation or migration of the stent. Summary. Coronary angioplasty or percutaneous coronary intervention, PCI, is a minimally invasive procedure to treat narrowed or blocked coronary arteries which supply oxygenated blood to your heart. It is a safe and effective procedure recommended for people with coronary artery disease or atherosclerosis. PCI relieves symptoms of chest pain and helps you lead a better quality of life.